Ben Day is from Healthcare Now, and Eagan Kemp is from Public Citizen, and they will bring us up to speed on some of the latest plans for the reintroduction of the Medicare for All legislation in the Congress, and then also what activists can do to support this effort in healthcare policy, including single payer systems, private health insurance, Medicare, Medicaid, and more. So now, before going to Public Citizen, Eagan served as a senior policy analyst at the U.S. Government Accountability Office. And Dende currently serves as executive director of Healthcare Now. And prior to taking on this role, he was the executive director of Mass Care, the Massachusetts campaign for single payer healthcare for 8 years. So congratulations to Ben for Healthcare Now for a very successful Medicare for All conference last week. So Ben and Eagan, you can take it away and give us the legislative update.
Yeah, thanks so much for having us today. It's always great to be on PNHP's call. Yes, as Susan said, my name is Eagan Kemp, and I'm the healthcare policy advocate for Public Citizen. It's always a pleasure to be with you all virtually. This is an exciting time and an important time in the Medicare for All movement. In the past few sessions of Congress, we have seen proof that your activism is growing the support for Medicare for All across the country. In the last session, 122 representatives in the House and 14 senators co-sponsored bills in support of Medicare for All. This is the most House co-sponsors we've ever had. Members of Democratic leadership are starting to come around in supporting Medicare for All and other progressive healthcare policies. And a lot of the work that you folks are doing on ACO REACH and other stuff is helping make that happen. And we're finally getting committee hearings to shine a spotlight on the need for Medicare for All in both the House and the Senate. However, we continue to see greedy corporations fight for their slice of healthcare dollars and putting profit ahead of patients. Attacks on healthcare continue, especially when it comes to Medicare and Medicaid, access to reproductive justice, appropriate care for transgender people, and especially youth. We must fight back while also pushing for progress. In this context, we're excited to announce that Representatives Pramila Jayapal, Debbie Dingell, and Senator Bernie Sanders will be reintroducing their versions of Medicare for All in the House and the Senate within the coming weeks. It will be a combined launch, which will be the first in recent sessions, and so we're very excited about that. It means that we just have a few weeks to get back to the record level of co-sponsors we had previously, meaning we have our work cut out for us. The sponsoring offices are working out the final details of the launch, and we'll be in touch soon with the final date and sort of additional details to help folks get activated. In the House, in the last session, we'd launched the bill with 111 co-sponsors, including Reps Jayapal and Dingell, and in the Senate, we launched with 15, including Senator Sanders. And I'm asking for your help for us to beat that number. The Medicare for All Acts of 2023 will be similar, nearly identical to the versions in the 117th Congress, with just minor changes to improve existing provisions. As such, the Medicare for All Act of 2023 in both the House and the Senate would provide comprehensive benefits and freedom of choice of doctors and hospitals for everyone residing in the United States, including all primary care, hospital and outpatient services, dental, vision, audiology, reproductive health services, gender-affirming care, maternity and newborn care, long-term services and support, prescription drugs, mental health, substance abuse treatment, laboratory and diagnostic services, ambulatory services, and more. There'll be no private insurance premiums, copays, or deductibles. Reduction in overall healthcare spending will take place, as well as improving care, improving the quality of care, and guaranteeing that folks get the care that they need. It will also ensure that Americans can get the prescription drugs that they need, and will also ensure high quality care for veterans and Native Americans through improving the programs they have access to now, while also guaranteeing access to their care through Medicare for All. In addition, both bills can include a just transition for workers in affected industries. The fight for Medicare for All, as you folks know, is more crucial than ever, and we continue to gain ground, even if not as rapidly as hoped. Pushing Biden on healthcare is going to be crucial. His administration is feeling the pressure on issues like Medicare Advantage ACO REACH, and prescription drugs, but they have been far too deferential to industry, as recent regulatory decisions have shown. Republicans control the House and are intent on tanking the economy ahead of the 2024 election, and are also trying to cut Medicaid, Social Security, and other crucial programs. There are still some factors working in our favor, though. Senator Sanders is in charge of the Senate Help Committee and is already using it to hold corporations to account for their bad deeds. We can expect many additional hearings, efforts, and legislation aimed at taking on the powers that be, particularly in healthcare. Also, Pelosi is no longer leading the Dems in the House, and Steny Hoyer is no longer her bulldog. Despite signing on to Medicare for All in the 90s, her rightward swing, as evidenced most recently by her being honored by the American Hospital Association for blocking common sense reforms like Medicare for All, just highlight how far she's fallen on healthcare issues. Some members, explicitly told folks they were scared to sign on because Pelosi or Hoyer or other folks were putting pressure on them. We'll need to keep the pressure up on Leader Hakeem Jeffries, not only to continue co-sponsoring Medicare for All, but to push back on the forces in the Democratic Party that are more beholden to corporations than they are focused on guaranteeing every person in the country gets the care that they need. We have exciting freshmen in the House particularly, but some in the Senate that will be Medicare for All champions, some that already are, including Rep. Garcia, who passed a municipal resolution in favor of Medicare for All and who founded Mayors for Medicare for All. As you all know, the COVID-19 pandemic laid bare just how broken our healthcare system is. This relaunch of Medicare for All must help capture the excitement for Medicare for All that we were building before the pandemic. It was just a few months before the pandemic that we delivered over 2 million petitions for Medicare for all across the House and the Senate. It was one of the last major actions before the world shut down. As such, we must regain and redouble that excitement and that push. Folks are familiar with the resolutions, push for municipal resolutions for Medicare for All. Over 100 have passed, but we need to pass 100 more in half the time. I want to close by asking again that you help us beat the previous record for co-sponsors. And we're also going to be doing a big push to also get other groups. Doctors and medical students have a crucial role to play in the fight for Medicare for All. And the time has come to get fired up and get even more involved in the fight. I'm calling on you. Thanks, folks. Pass it over to Ben.
Thanks, Eagan, and hi, everyone. It's great to see so many familiar faces out there, so many longtime and new kind of leaders in this fight. I'm just going to say a few things. One is that there's a few changes in the bill that Healthcare Now has been advocating for a long time that we haven't seen the bill revision yet, so I can't say with 100% certainty, but at least the indications from the lead sponsors are that they are going to make these changes. And to me, some of them are really important. I think when we're talking with legislators, probably we'll tell them there's not huge changes in the bill, because if they're previous co-sponsors, that's kind of their comfort zone. But I think there's been a few important improvements. One is that the bill always had kind of vague language about covering reproductive health, but it didn't explicitly lay out access to abortion services, which actually put us kind of to the right of a lot of centrist public option bills, which were explicit about covering abortion services. And I've told that is very likely to change in this version of the bill, which I think is important, and especially after the repeal of Roe v. Wade. And as you all know, when we pass a national health plan, either it's going to have abortion coverage or it won't. And the latter would just be a catastrophic loss of access to reproductive health coverage for women. So we can't not talk about this issue. So I think that's one really important one. Another one is access to transgender health, gender affirming care. The bill was kind of silent on that. And I don't know what's going to be in the bill about that actually, but I know that especially Rep. Jayapal's office has been talking with kind of trans advocacy groups about improving the language about that. So I think that's really, really important as well. And last but not least, we had language covering all residents, which was an improvement over the old bill that covered citizens many, many years ago, but it also didn't define who a resident was. And we also, much like reproductive health, you worry that a hostile Trump-like president comes in and says, well, reproductive health, that doesn't count abortion, or residents, that doesn't count undocumented people or people who haven't lived here for longer than X number of years or whatever. So we're kind of trying to precedent-proof the bill here. And I also just think that these are really important components of the bill for building the movement, the broader social movement and the alliances that we need, and having a moral bill where we're standing for the right things clearly. So anyway, those are not all the things we've advocated for in the bill, but we've been fighting for those for years and years and years now, and it sounds like we're finally going to get some motion on those. So that's exciting. So yeah, we don't know when this bill is going to be introduced, but we have reason to believe that it's going to be very, very soon, hopefully within the next month or so. So I guess the main message I want to convey here is that we do not have time to wait until we have a bill introduction date to start lobbying and advocating and pushing our legislators and trying to get commitments from them to be original co-sponsors. It could be that by the time we have an exact date, it's going to be introduced in the next week or the next 2 weeks or the next 2.5 weeks. And that's really not enough runtime to kind of mobilize all our forces. So I would suggest that you all start now. We've been trying at Healthcare Now to start right now. I'm going to share with you all, we have kind of a co-sponsor drive toolkit, and I will drop a link in the chat section here. Sorry. Here it is. So if any of those tools are helpful to you all, you're welcome to use them. It's just kind of a step-by-step guide, especially for folks who for folks who have not done this before all the time. Those of you who are more experienced activists, there's not going to be that much new there for you. And you know, this was from earlier in the year when we were just asking individuals to kind of contact their reps and senators, get a hold of who their health aide is, and have an initial conversation with them and see if you can get a probably yes or a maybe yes or a we don't know, or just get a sense of where their office is at. But now, since introduction is really looming, I would encourage you to connect with your local chapters if you have one, and kind of approach your offices in greater force and ask for an actual a delegation visit, a meeting with your organization. I would, amp up, reach out to your coalition allies in your states and in your districts. Try and bring multiple folks to the table. Try and bring folks to the table who have powerful stories to tell if you think you're going to need them. So I think it's not just reach out and information gathering time as it was earlier in the year. Now it's really exerting pressure time and lobbying time. That original co-sponsor number before the bill is even introduced matters a lot. Since we lost so many Democrats in the House, that always makes it extremely difficult to hit the same number you had before. I think we lost quite a few of the Medicare for All co-sponsors that we had last year. Certainly more than 20. I think it might have been more than 30. I don't have the number right in front of me. Some of those were folks who just retired and they're replaced by other progressives who were running on Medicare for All. We're likely to get them back. But again, as you all know, you've probably had plenty of experiences like this. You cannot take for granted that anyone, even if they said they ran on Medicare for All, is actually going to sign onto the bill as soon as they get there. You never know what kind of political calculations they're going to start making once they're in office. So it's really a full court press. We've also, of course, had many co-sponsors of the bill who have dropped off, especially keep an eye on anyone who rose into a leadership position. Maybe they're chairing, maybe they're even higher up now. That's often a way where you lose people as co-sponsors of the Medicare for All bill. So please use that toolkit. We're going to be developing more, I'm sure, as a national coalition between PNHP, Public Citizen, NNU, all the other national groups who are working on this. Usually we kind of pool our resources when it comes time for introducing the bill. We share, shareable social media graphics you can share on Twitter and Facebook and Instagram. We often come up with a joint petition that everyone can use nationally. So I think all those things are going to come very, very soon in the next 2 or 3 weeks. But for now, I would go back to your local organizations, your local groups and networks, and start mobilizing the forces, because you probably don't have much longer than 2 or 3 weeks to really push people on original co-sponsorship. So thanks so much, everyone, for your work. I really, really appreciate it.
Thanks. I just saw that Shannon Rotolo had a question or a couple of questions in the chat that I wanted to point out and ask Ben and Eagan to respond to. So are there any specific lessons learned from previous bills that we should keep in mind this time, things we need to do differently, or things that were successful that we need to do more of as we advocate for this bill?
Yeah, that's a great question. I think starting as early as possible, which as Ben pointed out means starting now, is sort of the winning strategy on getting co-sponsors that we've really been successful in over the last few launches at meeting or achieving a record each time. And so that's why we're really pushing folks to get started now, because that's really a key thing. Also to sort of make the activism fun, that it's sort of like identify folks in your community that are working on similar issues and pull them into the fight for Medicare for All. We've heard of a lot of folks sort of finding cross-cutting issues within Medicare for All, identifying additional activists. When you're meeting with members of Congress, bring not just doctors, but medical students, but also nurses that all sorts of different folks inside and out of healthcare, union members, so that you are, all of a sudden it's tougher for the member of Congress to ignore sort of this big group of folks, and also tell your story. That one of the most powerful things that doctors and medical students can do is tell the stories of yourselves and your patients, your experiences, because that's something very unique. And everyone has sort of challenges in the healthcare system, but you guys have unique experiences and unique training that can really help break through a members of Congress or their staff some of the reticence that they may have.
Yeah, I would just continue in that vein that it's a different answer depending on who your legislator is, right? If your legislator is pretty progressive, former co-sponsor, likely to sign on, you basically have to get over their threshold of paying attention to you and actually taking the steps to sign on, probably, unless they've had something that would cause a change of heart for them. But if you have a legislator who's not on the bill, but who's not, a crazy right-wing Republican, someone who you think you have a shot at, the answer is much more complicated. And I think that the things that have worked most in moving legislators who are kind of on the fence or near the fence is a combination of things. One is a coalition of organizations in their district who support it and are actively pushing it and actually expending some political capital to push them on it. And ideally, that coalition involves at least some organizations who are supporters of the legislator, not just all organizations who oppose them every time they run for office. So some kind of friends and confidants in there. Then number two is having just volume of constituents who are contacting them. And it has to be some one-on-one contact. It can't just be signing petitions or mass emails, which tend to be ignored. It has to be calling into the office or individualized email into the office, but ideally a one-on-one actually meeting with someone in the office. And again, that becomes a volume thing, the more numbers you can generate. And then finally, it does help sometimes to have sort of DC related organizations who have a relationship with that representative or senator to also push them. So I can tell you the story of, we had a 3-4 year campaign to move Rep. Kennedy here in Massachusetts. And we couldn't get him to sign on no matter what. So we got a huge coalition of organizations in his district. I think it was 40 plus organizations to sign a letter to him. They had a meeting with him, in district meeting, met with the rep. And then that wasn't enough. So we started standing outside of supermarkets in his district, and we would bring our cell phones. This was pre-COVID, so it was a little easier, but we would pre-dial the number and hand the cell phone to everyone walking to the supermarket and say, will you call them right now, 15 seconds to support Medicare for All? And we found that we could generate actually hundreds of phone calls per day with just 3 or 4 volunteers standing outside of supermarkets. And then we talked to our allies in DC, like Public Citizen, National Nurses United, Social Security Works, and they met with Kennedy's folks in DC and the DC staff. So I think when you have these tough legislators who are really hard to move, you need like a full court press. And none of our organizations can do this on our own. It really kind of takes all of us. And the thing that takes the most work is generating numbers of people in this district to pressure them. But those are the 3 things I think it really takes to push them and move them from like wiffle waffling to saying yes.